Hey everyone, so this is not going to be a long video. I just wanted to give a quick update, and this is part 2 to the last video I did. So I know I talked about me getting out of the hospital, me going to the hospital and everything. So now that I'm out of the hospital, I am getting treatments at home, so antibiotics. I am wrapping my legs of the stuff that they gave me. Um, doing a skin routine, vitals, diet, changing my diet because I have to, not because I want to. Uh, I'm going to be doing a weight loss program. I do have a nurse calling me once a week to check up on me, to check on my vitals, see how they are and everything. Uh, so that's been going on. I do have a nurse coming in once a week just to check on my vitals and to check on my leg and see how my leg is doing and all that. Uh, I also have physical therapy and occupational therapy coming in once or twice a week to check on that. I do have doctor's appointments as well. Uh, Sorry, my hair is a mess. I gotta redo it at some point. But anyway, I do have doctor's appointments coming up after being in the hospital. So I do have one follow-up appointment from being in the hospital with my PCP. Then I have another doctor's appointment. Well, I have quite a few coming up. Heart doctor's appointment, sleep study, lymphedema for my legs, and a few other appointments. I also have another appointment. Well, I'm going to be setting up a dentist appointment as well. So, uh, apparently, a couple of days ago, I bit into something. I don't know what it is, and I broke a tooth. As you can see, there's like a gap right here. Um, so, um, I don't know how that happened, but it happened one night when I was eating, and I don't know how that happened, but apparently I broke a tooth when I was eating dinner. So now I'm looking for a dentist as well. But anyway, other than that, I think I seem to be doing okay. Um, I forgot to mark down that I was doing exercises as well. But anyway, other than that, I'm doing good. This week I got some doctor's appointments. Well, not. I have a few appointments with OT, PT, and my nurse coming in. I was supposed to have a doctor's appointment today, but got rescheduled to another day. So, and then I'm supposed to try to call or find a dentist to help with the whole tooth situation. So that's the situation my tooth. I know in my last video I was gonna let you guys know what was happening with the tooth. That there's the thing that happened with my tooth is I don't know. I mean, I was eating a potato. Potatoes aren't hard. So I don't know exactly what happened. But anyway, that happened. Like I said, I am going to be making a dentist appointment. If I can find one, I don't actually have a dentist right now. I'm in process of looking for one, so hopefully I'll find one. Um, but anyway, uh, like I said, knock on wood, since I've been out of the hospital, I've been doing very well. I haven't really had many issues since I've been out of the hospital, so uh, everything has been good actually. I am very happy about that. Um, excuse me one moment. I gotta go over there and take my meds. Sorry about that, guys. Um, I almost forgot. I needed to take my medication. I am still on antibiotics for my infection. Um, so I'm on one medication to get rid of the infection. The other antibiotic is prevention, meaning it's to prevent any more infections or anything else from coming back. So I'm on that medication. The other antibiotic I already finished. I'm already on one last antibiotic. Um, I am taking a water pill and all of my other medications that I need to take. So, but yeah, that's all I really got for now. Um, that's really all the updates I have. Like I said, I got lymphedema on the January 5th. The 7th of January, I got sleep study. The 23rd of January, I got heart doctor. So, and then I believe the 6th, I got my follow up with the doctor from, went to my PCP to do a follow up from when I was in the hospital. So pretty much we're all up to date. I'm doing everything I'm supposed to do. So basically, you guys are all um, up to date with everything that's been going on. I will continue to keep everyone informed on what has been going on. The leg does look a little bit better. Um, yes, it does still look red, or maybe a little darker red. Um, but it is looking better. Like I said, I have been losing a lot of weight since I have been on the, like I said, the water pills. So, um, it's been like, I want to say off and on with the weight, but other than that, I do believe I've been doing okay with that. But like I said, I don't want to keep this video too long. this is more of just an update of um how things have been going at home. This is the second video to the first video I was doing. Uh, but as I was saying, I was gonna do a video, a couple of videos in the hospital, but I did have a roommate, so I couldn't do any videos in the hospital because I didn't want, I wanted to respect my roommate's privacy when I was in the hospital. So that's why I didn't video anything. Uh, so, um, but I did, um, I, I didn't even want to go in the hospital to tell you the truth, but I had to go because of my leg. I almost ended up, to tell you the truth, I almost ended up there again, um, a little bit after Christmas, um, because of, I think I had too much salt. I was having some heart issues and some blood pressure issues, and I almost had to go back, but I didn't go back in because it corrected itself, so I was fine. But Jason would have sent me back in if I needed to go. Um, so that's the reason why I say I do have to be careful on my diet. Um, some things that I used to be able to eat does not agree with me anymore. And of course, as you get older, your body's gonna change. A lot of things that you used to eat, you won't be able to eat anymore. So, like me, I like eating a lot of foods that don't agree with me. Like I love sweets, I love salty foods, I love junk food, I love greasy food. There's all kinds of food that I like to eat, like processed food, all of that stuff. But my body can't digest it anymore. So now I have to go on um, I want to say, I need to eat healthier food, uh, which I don't want to, but it's something that I need to do. This is like, it's something that my doctor wants. Um, he told me that he wanted me to go on a weight loss program at least. Like, um, I was doing Ozempic and all that stuff, but um, the GLP ones, right? But I was having issues with the shots, so they were talking about me taking the pills. They also make pills as well, but they told me that they thought I should at least think about doing the pills. I need to be on some type of weight loss program to lose more of the weight. So I guess we will see. I am going to talk to my doctor, I guess, um, to see what she thinks on that. So I did tell them that apparently, like I said, I'm very sensitive to the shots, but hopefully, maybe taking a pill will help. But I'm not sure. We will wait to see on that. Um, so we will see, I guess, at least. But anyway, on that note, I do want to say that I am going to try very hard to keep up with everything. I am going to try really hard to continue with my treatment at home, working with everybody, trying to lose the weight, uh, going to the lymphedema clinic, seeing what I can do there. Uh, but I do have something here that will help. I can't find the remote right now. Um, but anyway, I think I am gonna end the video right here. I do not want to make it any longer than it is. So, any questions, comments, let me know, and I will see you guys in the next one. Bye.